Today I'm going to be talking about memory loss, what's normal and what's not as we get older. I'd like to start with some facts about our aging population. We're living longer, that's a fact. In 1900, the average life expectancy from birth for a person living in the United States was 47.3 years, and now we're living about 30 years longer. A major cause of death in 1900 was infection. Many people died from pneumonia and infected wounds that led to septicemia. We're living longer because of medical advances in the treatment of cancer, heart disease, stroke, and many other medical conditions. We now have many different antibiotics and vaccines, improved sanitation, and a ready supply of clean drinking water. Every day in this country, about 10,000 people turn age 65, and this will continue for another decade and longer. Presently, there are over 50,000 Americans who are 100 years of age or older. As it turns out, and unfortunately, age is the #1 risk factor for developing memory disorders, such as mild cognitive impairment, or MCI, and the various forms of progressive dementia. 95% of all cases of Alzheimer's dementia are among those individuals who are 65 years of age or older. Now, this shows a breakdown of different categories, with normal age-related cognitive decline at the top. The two at the bottom, MCI, mild cognitive impairment, and dementia, are actual cognitive disorders. I'm going to talk about normal age-related cognitive decline so that you can understand what's normal first before I talk about what's abnormal. What is age-related cognitive decline? We change as we get older. And what changes are normal as we age? Our short-term memory declines. It gets weaker. It's harder to learn new information. And this is because our hippocampus shrinks. It's a part of the brain that has to do with taking new information and putting it into storage. But we compensate for this. We write things down, we keep appointment books, wall calendars, whatever, to help us with that. So we just compensate as we get older. Most people notice that their memories are worse in their 40s or 50s, but by that time you've adapted. Our attention span also gets shorter and weaker as we get older. And this actually is a reason why our memory is not as good, because you have to attend to something just long enough for it to get into memory storage. Our speed of information processing slows down. And this is why you don't see old quarterbacks, old fighter pilots, or old race car drivers. We just can't process information as quickly as we could when we were younger. This is also why seniors drive slower. What they're actually doing is giving themselves more reaction time. Our ability to do multiple tasks at the same time also declines. This all falls under a category called executive functioning. This declines because our frontal lobe shrinks, unfortunately. Our vocabulary and general knowledge actually increases as we get older. This is because of advances in evolution of our culture and our technology. We're always learning new words. We're using language every day. We're reading, we're watching television, we're talking to other people. So our vocabulary can actually get stronger if we're normal. Now, what does not change as we age if we're normal? Our immediate recall. If I was to give you a 7-digit number, you should be able to give that right back to me. Our verbal intellect doesn't decline, doesn't change. I mentioned that before. It can actually get stronger as we get older. Our long-term memory does not decline as we get older if we're normal. Now, even individuals who have early to middle stage Alzheimer's dementia, their recall of old information is still good for the most part. You just need to give them cues and reminders, but those memories are there. They just need a reason to recall that information. The problem with people with Alzheimer's disease is they can't learn new information very well, and eventually they become completely unable to learn any new information. But for quite a while, they can still recall the old information. Our ability to learn new information is still strong. Because our short-term memory is weaker, it takes us a little longer. But everyone should keep learning new information. This is really good for the brain. we grow new connections, and particularly those individuals who are retired need to keep learning new things, such as a musical instrument or a new language or how to paint, something like that. Take up a hobby that requires cognitive attention and effort. Our intelligence does not decline as we get older, interestingly enough. And it's actually enhanced by life experience. And what is that? Wisdom. John F. Kennedy said, wisdom comes from experience, and experience comes from making mistakes. Okay, I'd like to talk about some everyday complaints. Many people tell me that they have difficulty remembering the names of new people that they meet. Should you be concerned about that? Not really. That is a universal problem. And the reason is, we're in the middle of a conversation when we meet someone, and we don't have time to focus on that name. Now, there's an old saying that repetition is the branding iron of knowledge, and you don't have time to repeat that name. That's why it doesn't stick. Unless the name is descriptive. For example, if the person's nickname is Red and they have red hair, then you have a cue there. But most people don't have that. If you make a real effort to focus on their name, you're more likely to remember it. So I wouldn't worry about that. Concern is when people cannot remember the names of familiar people, such as their grandchildren. And I always ask about that when I do an evaluation. I also ask, who's the president? Who's the president before our current president? Who is the president who was killed in Dallas, Texas? Another example is, do you ever walk into a room and not remember why you walked into that room? If I give a talk to a group of people and I ask them that question, everyone in the room will raise their hand. So that's not clinically meaningful. So it's not anything to be concerned about unless it's a very frequent occurrence. How often does that happen? If it's once every few weeks, that's no big deal. The reason is we're distractible. Our minds wander. Let's say you're reading the newspaper and you see an article you want to cut out of the newspaper, but the scissors are in the bedroom. So you get up, walk to the bedroom. When you're walking to the bedroom, your mind wanders about something you need to get from the store. When you get to the bedroom, you don't have a cue. The newspaper is not in there. There's no cue. So you're frustrated. Why am I in this room? You go back to the living room, you see the newspaper. That's your cue. Now you go back and you find the scissors and everything's fine. But that's human nature. That's just what happens to us. So I wouldn't be concerned about that unless it happened every day or several times a week. And this is what happens to people who have genuine memory disorders or impairment. But there are common causes for normal forgetfulness and factors affecting cognitive functioning. For example, not paying enough attention to something. The way the memory system works is you have to pay attention to allow the information to get into the system. And if you're rushing through something, you can miss details. And as I said before, as we get older, our attention span gets weaker. And because of that, we need to focus a little longer on things just to compensate for that. That's a good thing to keep in mind as you get older. If you're putting your keys down in a place that you don't usually put your keys and you're not paying attention to that, you can lose your keys or your cell phone. But that's typical because you're not paying attention. Distractions. Our lives are filled with distractions. These things can interfere with your focus, and anything that affects your focus can affect retaining new information. Stress, anxiety can definitely impact memory and cognitive functioning. Poor sleep, sleep deprivation can definitely affect your attention span and your concentration the next day. Another problem that a lot of people actually have and they don't know it is sleep apnea. That is actually a fairly serious condition. It's where the person stops breathing dozens of times every night or even hundreds of times every night, but they don't know it. So if someone snores loudly and it's actually keeping their partner awake, or their partner notices that the person is not breathing for brief periods of time, this is definitely something that needs to be checked out. Just talk to your primary care physician, who will likely order a sleep study, and they can diagnose that quite easily. low blood sugar. If you haven't eaten in a while, your brain's not getting enough fuel. The brain runs on glucose. Dehydration is another cause for your brain not working at its optimal level. Normal grief and depression can definitely impact cognitive functioning. It can affect sleep, energy level, motivation, attention span. If someone is grieving a loss, they're not going to be functioning normally cognitively. And of course, certain medications can impact cognitive functioning to a large degree in some cases, such as with pain medications or anti-anxiety medications. There are signs that suggest that there is a cognitive disorder that needs to be further evaluated. If there has been a noticeable change in thinking, memory, language, judgment, problem solving, etc., that is definite and persistent. It's not something that just has lasted for a week because someone's had a bad cold or they started a new medication or they're not sleeping well. This is something that has been lasting over perhaps months or even years. And if it's gradually getting worse, that's an indication that this is something that needs to be checked out because something's going on. Now, there are potentially reversible causes for memory problems, and that is an excellent reason to seek consultation with your primary care physician. Now, what are signs of a possible memory problem in an older adult? I work primarily with seniors, people over the age of 65 who are retired. And I see them a lot of times because their children are concerned about their loved ones. So what do the children notice? If the person who has the memory problem has been living in the same house for 35 years, they're still driving, their lives consist of many overlearned routines. Their cars can practically drive to the bank or the church without them even thinking about it. They've done it hundreds, if not thousands of times. So they don't have to think about it. They're not having to learn anything new. So how might a memory problem be expressed in an older adult who's retired but living in the same house and they have their routines? Well, the children will notice these things, that their loved one may start asking the same questions repeatedly because they can't remember that they asked the question before, or they can't remember what the answer was. The new information's not being stored. It's not sticking. They're forgetting recent conversations, a conversation they had yesterday or last week or even earlier in the day. They're frequently misplacing belongings. They're losing their eyeglasses or hearing aids or keys or cell phones. They're not remembering the names of familiar people, for example, their grandchildren or a neighbor that has been living next to them for 20 years. They're forgetting that something is cooking on the stove, and you can see what a serious problem that might be. Forgetting to pay bills or paying bills more than once. Forgetting appointments or forgetting to take medication when they're supposed to be taking it. Now, someone can actually forget to take it to begin with, but they can forget that they've already taken it and accidentally overdose on a medication. Or they can stop doing things that require memory, such as reading a novel or playing bridge. Sometimes the earliest indication is when someone gets a new cell phone, a new device, and they have to learn the steps on how to use it, or a new television remote. I hear this a lot. I bought my mom a new phone and she just cannot figure out how to use it. So these are early warning signs. So what should you do if you've noticed these changes in yourself, a loved one, or a friend? Well, set up an appointment with your primary care physician and go in with your loved one and explain what you've seen and what your concerns are, what changes that you've observed over time, particularly if it's getting worse. If you feel like there's been a definite change, it's important to say that to the doctor The doctor will then administer a screening instrument, and that will oftentimes lead to a referral to someone like me. I do a full comprehensive memory assessment, and it's very important to go in with your loved one, because what I often see is seniors, people in their 70s or 80s who are living independently. They go in to see their primary care physician by themselves, and they may notice that they're having memory problems, and they may not want to reveal that because they don't want to lose their independence, their freedom. They don't want to become a burden to their children. Or they actually may be forgetting that they forget, and they have poor insight into the fact that they have a memory problem. But the family members don't forget. So that's why it's really important to go in with your loved one if you think there is a problem. Now, what is a comprehensive memory evaluation from a medical standpoint? The primary care physician will do a comprehensive medical history, review all the medications, probably conduct a complete physical examination to see if there are any new problems. The primary care physician may refer the patient for a neurological evaluation, certainly blood work, a urinalysis, and neuropsychological testing, which is what I do, possibly a brain scan, and possibly analysis of cerebral spinal fluid, although that's much less common. But all this information will help the doctor to determine if there is a genuine problem and develop a treatment plan to address this problem. That concludes our topic for today. I want to thank you for watching. I would encourage you to check out other videos that we have on our website. I think you'll find them very useful.